Hi everyone, in this session we will talk about the antidepressant drugs. Antidepressants are those drugs which is used to relieve the depression. So here we will talk about that what will occur inside the depression. What is depression? The classical symptoms of depression are sadness, hopelessness, helplessness, and insomnia, and sometimes there will be increase in sleep. And sleep pattern changes will also be occur in depression. Libido will also be occur in depression. Libido mean there will be changes. There will be changes in sexual desire or disturbance in sexual desire. Headache will also be there in depression. Headache, pains. There are a lot of symptoms of depression is present, but these are the classical symptoms of depression. Pharmacologically, according to biogenic amine theory, biogenic amine theory said that there are certain chemicals, there are some chemicals which play the most important role in the process of depression, like serotonin, dopamine, and norepinephrine. These are actually the monoamines. These are the monoamine. These are the neurotransmitter chemical messenger which play the most important role in the process of depression. So, biogenic amine theory said that the deficiency of these chemicals, the deficiency of monoamines, are called the depression. When deficiency of this chemical occur, so the patient will face the depression. Now we will talk about the pathophysiology of depression. First we will talk about the physiology and then the pathology of the process of depression. The pathophysiology of depression. In depression, normally the physiology of depression, normally for example this is the presynaptic membrane. And this is the postsynaptic membrane. Here in the presynaptic membrane, from the extracellular fluid, the serotonin are enter into the presynaptic membrane. Here in the extracellular fluid, serotonin are prepared or synthesized. Serotonin are actually this is also called the happy chemicals, which play the most important role in happiness of the patient. These are serotonin which is synthesized from outside the neuronal membrane. When they enter into the presynaptic membrane, here they will be stored in the vesicle. These vesicles are responsible to store this serotonin. And here some other content are also present, some enzyme like these enzymes are called the monoamine oxidase, which is responsible for the metabolism of neurotransmitter. When this neurotransmitter enter into the free synaptic membrane, and when conduction occur, some impulses are transmitted from one neuron to another neuron. When conduction occur, so this serotonin will be released from this vesicle due to calcium ion channel, and they will release from the presynaptic membrane and enter into the synaptic cleft. These are the synaptic cleft. When they enter into the synaptic cleft, here some receptors are present at the fourth synaptic membrane. In which the serotonin will act on these receptors. And they show their function. They enter into the fourth synaptic membrane, and they show their action like happiness, etc., etc. So this is the normal phenomena. Here at the in the free synaptic membrane, some transporter are present. These transporter are called the serotonin transporter. The serotonin transporter are responsible to attract the serotonin from the synaptic cleft and enter this serotonin into again the free synaptic membrane. This is the normal phenomena. The serotonin are enter into the free synaptic membrane and released from the free synaptic membrane and act on the receptor of the fourth synaptic membrane and show their function. So when the serotonin transporter SERT, the serotonin transporter trap this, for example, these are the neurotransmitters such as serotonin. This serotonin transporter will trap this serotonin from the synaptic cleft, and again this serotonin will enter into the fourth synaptic free synaptic membrane. Here in the free synaptic membrane, the MAO are present, monoamine oxidase enzyme are present, which is responsible for the serotonin metabolism. This enzyme will be metabolize this serotonin, so the deficiency of serotonin will occur. The deficiency of serotonin will occur towards the receptor of the fourth synaptic membrane, and conduction will there will be no conduction. Conduction occur, but there will be deficiency of serotonin will occur. So the patient will feel sadness, hopelessness, insomnia, etc., etc. The classical symptom will show here. This is the example of serotonin. Now the norepinephrine. Norepinephrine is the same phenomena here in the norepinephrine. In place of serotonin, the norepinephrine will enter into the free synaptic membrane, and they are stored in the vesicle of the norepinephrine, and they release due to conduction. They will release and act on the receptor of the fourth synaptic membrane and show their action. But here, in place of serotonin transporter, there are another transporter are present for the norepinephrine, such as norepinephrine transporter. Norepinephrine transporter will act on this norepinephrine and trap this norepinephrine, and again enter this norepinephrine into the free synaptic membrane, and deficiency of norepinephrine will occur. Here the dopamine for dopamine also some transporter are present, and deficiency of dopamine will occur. So when the deficiency of these monoamines such as serotonin, norepinephrine and dopamine occur, so the patient will face these type of symptom like insomnia, increase in sleep, hopelessness, helplessness, sometimes sexual problem, etc., etc. So these are the pathophysiology of the Parkinson, So these are the pathophysiology of the depression. Now we will talk about the antidepressant, that how we use the antidepressant to relieve the process of depression and to increase. Normally the antidepressant will increase the monoamines. Because in depression, the deficiency of monoamines will occur, like monoamines such as serotonin, dopamine, and norepinephrine. So antidepressant will increase these bioamines are such as serotonin, dopamine, or norepinephrine. There are two types of antidepressant which is used to increase the concentration of monoamines such as serotonin, norepinephrine, and dopamine. First is typical antidepressant. In typical antidepressant, there will be typical antidepressant will only act on the serotonin transporter, dopamine transporter, and norepinephrine transporter, and they will also be act on the monoamine oxidase enzyme. For example, this is the presynaptic membrane and this is the postsynaptic membrane. Here this is the serotonin transporter. Normally in depression, the deficiency of serotonin will occur due to this serotonin transporter, because they trap the serotonin from the synaptic cleft and again enter this serotonin into the presynaptic membrane. Here in typical antidepressant are those antidepressants which act only in this transporter, and here the enzyme which is called monoamine oxidase, and typical antidepressant also act on the monoamine oxidase enzyme. Here for the serotonin transporter, the drug of choice which is used nowadays, which is widely used nowadays, such as Ssri. Ssri mean selective serotonin reuptake inhibitor. Selective serotonin reuptake inhibitor, Ssri, are used to block this serotonin transporter, to inhibit this transporter. Ssri will inhibit this transporter, and due to when the serotonin transporter inhibit, unfortunately the concentration of the serotonin will increase. There will be increased concentration of serotonin. When the serotonin concentration increases, the serotonin will act on the postsynaptic membrane and show their function. So Ssri will be used here, the drug of choice. These are safely in place of other antidepressant. Ssri, for example, there are a lot of Ssri, but the most widely used Ssri are escitalopram, citalopram, fluoxetine, sertraline, and other feroxetine, etc. These are different Ssris which is used, which act on the serotonin transporter, such as escitalopram, which is present in different brands like Star, Citanu, etc. Citalopram, fluoxetine, sertraline, and feroxetine. These are the Ssri which is widely used to inhibit the serotonin transporter and increase the concentration of serotonin. Now, these are actually the pharmacodynamic of the SSRIs. Now, the therapeutic uses of these SSRIs are therapeutic uses. In therapeutic uses, they will be used in depression, generalized anxiety, and certain other types of anxiety. The SSRI will be used. Now, the pharmacodynamic of the pharmacokinetic of the SSRI drug, such as antidepressant, all the CNS depressant are easily absorbed from the stomach. They will be easily absorbed from the stomach. They will be easily absorbed from the stomach and enter into the systemic circulation. Enter into the systemic circulation. During the first 1 to 2 weeks of the SSRI, there are some side effects will be observed, like drowsiness, sedation, etc., etc. There are some side effects will be there, but with time these side effects will be hide, because these SSRI will adjust themselves and they will cross the blood-brain barrier and adjust themselves in the neuron. So the first symptoms are temporary and they will be hide. They are easily absorbed from the stomach and enter into the systemic circulation, and then metabolism occur in the liver. In the liver, with the help of cytochrome P450, the metabolism of SSRI will be occur. And glucuronide conjugation, and sulfate conjugation will be there in the liver. There are some SSRI like sertraline. Sertraline will show the first pass effect. So for sertraline, food will be essential. This type of SSRI which act on the portal vein and they show the first pass effect. For this SSRI, the food will be essential. This type of SSRI will be taken with food. Now, the half-life of SSRI, the half-life of selective serotonin reuptake inhibitor will be 16 to 24 hours for SSRI half-life. But there are some SSRI like fluoxetine. The half-life of fluoxetine are 50 hours. So after 50 hours, this type of SSRI will be taken. After 1 week, they will be taken, this fluoxetine SSRI. There are some adverse effects of SSRI, selective serotonin reuptake inhibitor. First adverse effects are sleep disturbance. The SSRI will cause the sleep disturbance like ferroxetine and fluoxamine. The ferroxetine and fluoxamine are actually the SSRI. This will cause the sedation. So sometimes the SSRI will cause the sleeping problems, sleeping disturbances. The second adverse effect is sexual dysfunction like erectile dysfunctions, sperm motility problem, etc., etc. This type of adverse effect will be there after the overuse of the selective serotonin reuptake inhibitor SSRI. So when the patient feel like this type of problem, they need to take sildenafil and vardenafil, etc. The use of SSRI in children, sometimes the use of SSRI in children are essential, but in USA The FDA approved this type of SSRI for children because the OCD problem, a lot of OCD problem are there in USA in children. The overdose of Ssri will cause the serotonin syndrome. Serotonin syndrome means that the increased concentration of serotonin, which will the patient will show some symptom like hyperthermia, sweating, etc. Discontinuation syndrome will be there if the patient abruptly stops the SSRI. This type of patient will show some symptom like nervousness, other symptoms like malaise, headache, etc. That's all about the typical antidepressants such as Ssri. In the next slide, we will talk about the SNRI, serotonin norepinephrine reuptake inhibitor.